Welcome to week 5 of the chain programme. You're just over halfway there. In today's talk, we're going to discuss heat and cold therapy, manual therapy and massage, electrotherapy and cycling technique. You'll be familiar with this slide. This is the NICE guidelines for the conservative management of osteoarthritis of the hip. Today we're particularly interested in manual therapy and stretching, heat and cold and electrical stimulation, and of course regular exercise. Heat is thought to work by improving muscle relaxation and improving the circulation to the tissues around the joint, and this can be achieved by using either a warming cream or even using a hot water bottle on your hip, or using a cream that you can purchase over the counter that increases the warmth of the skin around the hip. Cold therapy is thought to numb pain, reduce blood flow to the joint and to block nerve impulses that can affect the joint. This can be achieved by using a pack of ice or a cold spray. Manual therapy can have positive effects on your biomechanics around the hip and the neurophysiology around the hip, thus changing the way that you feel pain and obviously improving the way that your hip can move. It improves movement by changing the elasticity around the joint capsule, the tissue that surrounds the hip joint, and also affects the length of muscle. Electrical stimulation is the stimulation of muscle using electrical impulses. It works by stimulating joint tissue, and this causes a slow-acting but long-lasting response that can lead to reduction in pain. They're available on the high street or on various online stores, and they cost approximately £20. The NICE guidelines suggest using TENS as an adjunct to other therapies. Acupuncture is a form of alternative therapy that involves sticking fine needles into the skin around the joint or in other places on the body. By using the appropriate points, it's felt that you can reduce pain and improve function. However, a recent Cochrane review revealed that acupuncture had no effect on pain relief or function after 8 weeks of treatment. Therefore, the NICE guidelines do not recommend acupuncture in the treatment of osteoarthritis of the hip.
Okay, so this week when you're spinning, you want to concentrate on the action of pushing down and pulling up. So the instinct is for all the effort to happen when you're pushing the pedals down. That's great, but you want to get an equal effort on the way up. So make sure your toe clips are nice and tight, that you're working with a flat foot, and that you're consciously pulling up from the bottom of the pedal action. So from that 6 o'clock right up to 12 o'clock, there is an action that you're really consciously pulling the foot up.
In summary, heat can improve circulation, cold therapy can reduce pain. Manual therapy and massage can help with the symptoms of osteoarthritis if it's mild or moderate. Manual therapy and massage can help to reduce pain and increase function in hip osteoarthritis. Electrical stimulation may have an effect through stimulating joint tissue. And finally, NICE guidelines do not recommend the use of acupuncture for hip osteoarthritis.